first step is to identify the patient and its condition. Next is to gather all the necessary equipments and place at the bedsides. After that, explain the procedure and ask for the patient permission. Good day, ma'am. I am Rexanne from Bsn-I Nightingale, and today I'm going to assess you for your hair care routine or bed shampoo. Is that okay with you, ma'am? Before the procedure, don't forget to perform hand hygiene and wear gloves. Next is to place the waterproof pad under the client's head and shoulders. And then, put the towel over the client's shoulder. After that, place a washcloth to pad the rim where the client's neck touches the board. The blanket cover over the client's body and ensure the privacy. Next step is to place the washcloths over the client's eyes. Remove the pins, clips, ribbons from clients and then comb the hair first before wetting. Step is to place cotton balls in the client's ears. Ensure to place the basin in a position to catch water. Place bucket on floor underneath the drain of the shampoo board or caddy pad. Pour pitcher of warm water slowly over patient's head, making sure that all hair is saturated. Refill pitcher if needed. Note that warm water should be between 43 degrees Celsius and 46 degrees Celsius. Next step is to apply a small amount of shampoo to the patient's hair. Massage deep into the scalp, being careful to avoid any cuts, lesions, or sore spots. If patient has thick hair or requests, apply a small amount of conditioner to the hair and massage throughout. Avoid any cuts, lesions, or sore spots. After that, rinse with warm water between 43 degrees Celsius and 46 degrees Celsius until all shampoo is out of hair. Repeat shampoo if necessary. Pat and dry the patient's hair using washcloths and careful to avoid any cuts, lesions, or sore spots. After the procedure, make sure to remove all the washcloths that you use towels in the client's ears and other washcloths over the client's head and shoulders. And then remove protective padding but keep one dry protective cloth under the patient's hair. Place towel around patient's hair and remove Kelly pad or shampoo board. Gently brush hair, removing any tangles as needed. Blow dry hair on a cool setting if allowed and if patient wishes. Next is to remove gloves, perform hand hygiene and aftercare. And lastly, document hair wash or cuts, lesions that are found.